Hi, my name is Steve Jennings. I'm 47 years old and live in Lower Hamilton. I volunteered to be the patient ambassador for Socks Off campaign. Try to get my story out to doctors and healthcare providers to check their diabetic patients' feet. I was diagnosed with type 2 diabetes in my early 20s. I didn't take it seriously. I didn't take my medications. I didn't check my feet. I was a young man who didn't think diabetes was going to affect me. Diabetes doesn't care. It doesn't care if you're young, if you're old, if you're heavy, if you're thin, and it may not show up right away. Diabetes can stay dormant for years and not really affect your lifestyle until it does. 10 years went by with no complications, no effects from diabetes. One Christmas, I was refereeing a hockey tournament, and after the last game, I noticed a blister on the side of my right foot. And a few days later, I noticed that my foot was starting to turn red. I ended up with a huge ulcer on the side of my right foot, which turned into ulcers on both feet. When you're sitting there in a doctor's office and they come up with the recommendation of an amputation, it's extremely scary. And so I talked to my family and close friends for a couple weeks before I came back to the surgeon and said, I think it's the best idea for my quality of life, which now I'm back doing umpiring baseball, involved in hockey, which is huge for me. To take care of my right foot now, I check it every day, make sure that there's no calluses. I routinely go back to Dr. Meyer, who checks my foot, takes care of my toenails, takes care of any calluses or any imperfections in my feet, in my foot, so that I can save this one. The importance of checking your feet regularly, taking your medication, taking care of diabetes, even if you don't think it's affecting you, it's affecting you.